I'm Roslyn Boyd. I'm the Associate Professor of Cerebral Palsy and Rehabilitation Research, and I am the Scientific Director of our Queensland Cerebral Palsy and Rehabilitation Research Centre. Cerebral palsy is the most common physical disability in childhood. It affects about 1 in 500 young Australians. It occurs around the time of birth, either just before birth or at the time of birth, and it affects movement in children. So it could be as minimal as a child who walks on their toes, or it could be a child who is affected down one side of their body. That's what we call a hemiplegia. Or it could be a child who's more severely involved, who's unable to walk and may have difficulty moving from one position to another. It's not necessarily affecting their cognitive development, and only about 30% of the children have a problem with their learning. Okay, so people have that misconception about cerebral palsy, but it is a physical disability, not necessarily impacting on their mental development. It's a lifelong condition in that the children have the injury around the time of birth, and it's with them through their life. So many of the things that we're doing not only are about early detection, we're also trying to improve the outcome by trying to ameliorate the sort of problems that develop. Because during childhood, their musculoskeletal problems, like problems with their muscles and bones, can get worse. So they can get problems with their hips, problems with their walking, muscle contractures. And so we have a sort of lifespan approach. We're looking at focusing on early development, but we're also interested in how adolescents turn out and the impact on their quality of life. And later on, probably next year, we'll start looking at the study of adults with cerebral palsy to inform our studies that we do in children. I guess the main one that we've been doing has been the Queensland Cerebral Palsy Child Study. The main question that we're asking in that study is there a relationship between the brain injury or brain structure and their early motor development, so that we can follow these children from 18 months corrected age who were born in 3 birth years, 2006, 2007 and 2008. So we're recruiting all those children born right across Queensland, and we look at how their early motor development is so that we can help with prediction of their outcome. We're also looking at how their hips develop related to the hip surveillance program that we run here in Cerebral Palsy Health Service, and we're looking at their participation in everyday life, their feeding and cognition. We have a very new study that just started, which is about growth and nutrition. And this is the first sort of longitudinal study, which we're running with the Children's Nutrition Research Centre, looking at early growth of children with cerebral palsy, the food intake that they have, the energy requirements, and their feeding skills. Because it could be that you have the early brain injury, but then if you have difficulties with feeding, you could have a secondary effect on your brain development. So this is quite an important study for us, and we'll have new studies starting with the very young infants to see what the impact is on brain growth and brain development. I think children born in Queensland who are unfortunate enough to have cerebral palsy are very fortunate to be living in Queensland, because we have the most comprehensive statewide services in Australia that cover the whole state. Not only where children come to us for specialist clinics, but actually our specialist clinics go out to them. The other important factor is that we now have the research through the sort of donations that we've had to the foundation. We've been fortunate enough now to set up this research centre, which really incorporates the research right alongside clinical practice. So parents can have their questions answered, and the most important questions that parents have identified recently and researchers are the questions are, what is the cause of cerebral palsy? Can we prevent it? And can we improve the outcome? And there are 3 questions that we're very focused on answering. And over the next 5 years, we hope to be able to answer those first 2 questions more specifically. What might be the causes of cerebral palsy? How might we improve the outcome? And part of the exciting news that we have too, just coming in November, will be the first centre in the Southern Hemisphere to have an MR-compatible incubator. This is a little incubator for the very tiny babies. When they're very premature, we'll be able to measure their brains. So we'll be able to look at their brain development, help in predicting outcome, helping in measuring early interventions, and helping about that sort of why factor in what causes cerebral palsy. So I've got a picture of it here actually. Previously we've only been able to do babies from about term, and we had to wrap them up and let them go to sleep and go in the MRI scanner on their own. Now we'll be able to put them in even when they're very tiny at sort of 24, 25 weeks gestation, safely in the incubator. If they need to be ventilated or have oxygen, that can all happen, and we can take some very good pictures of their brain to know exactly what's going on. So this will be arriving in November, and that's a really important step forward with support from the Foundation and support from our donors. So it's a sort of world first it's a Southern Hemisphere first for us, this will be the first one in Australasia. So we're actually taking a bigger picture look at cerebral palsy. We're not just looking at the impairments, we're actually looking at their community levels of activity, their health, and their nutritional status. Also coming along online, we'll have a new study for adolescents looking at bone health. Now, children with cerebral palsy have, because of their brain injury, have reduced levels of activity, and this, like women in middle years, has an impact on their bone health. And so children could be at risk with earlier osteoporosis with cerebral palsy. It could be related to bone pain that they have, and we want to answer those questions. So that's the sort of area that we're really looking for funding at the moment, both nationally and from our donors, to see if we can get started on looking at that bone health study. The other most important study, I think, is with the arrival of the incubator, we'll have several new studies that we'll be looking at in relation to better brain outcomes for children after injury, what we've called Queensland Children's Bobby. So it's Queensland Children's Better Outcomes After Brain Injury. So we'll be looking at using the MR incubator in these young babies to see if we can identify when an injury might have occurred, do some studies that will look at early interventions, and then look at our clinical cohorts to answer the questions about how they're turning out and how they're responding to treatment. We also hope, if we receive sufficient funding, to be doing some very novel interventions, looking at things like stem cell therapy, to whether this could be in the future, in the next 10 years, a treatment for children with cerebral palsy. So with the University of Queensland, with Stem Cell Research Centre, we'll be looking at novel therapies in a preclinical model. It's some way off yet before we'll be doing anything in children, but we need to sort of really have the funding now to start this preclinical work and think whether there's potential opportunities there for brain repair. The important thing is that people who donate to the Foundation and who have been donating to us can actually get to see where their money goes, what the impact is for families, not only in some of these information about the causes of cerebral palsy and the prognosis, but what novel treatments might work and how might we improve children's participation in everyday life and their quality of life. And that also goes for the quality of life of the parents. We're actually doing now some parenting studies with Matt Sanders from Triple P, where we're looking at parenting programs to try and help families with that early diagnosis period, with that early development. So donations to the Royal Children's Hospital Foundation really have a direct impact on the lives of these children with cerebral palsy and their parents. We've been very fortunate with the support we've had from the Foundation, but obviously, you know, in the current economic climate, it's a bit of a challenge for everybody, and having ongoing sustainable research funding is really important for us. And we want to be able to continue this research alongside clinical practice so that it makes a difference for Queensland's children, and it's very integrated then into clinical services and what families want for their child with cerebral palsy.